Hello, my name is Evelina Figueroa, and I'm going to talk about the Deming cycle, and I'm going to give some example. The introduction about what is the Deming cycle is known also as a Plan, Do, Check, and Act, that is the same as a PDCA, or Plan, Do, Study, Act, that is the same as a PDSA cycle. It's a systematic, interactive, four-step problem-solving process that is actually used for continuous quality improvement in various fields, including healthcare, education, and business. The first step of the Deming cycle is plan, okay? So the plan is when you identify an opportunity or problem, and you at that moment you define the objective and plan, and you make a plan to change or intervene based on the data and the analysis that you made. Okay. And for example, I work in as a family nurse practitioner in a primary care, and I have a lot of patients with diabetes type 2. And one of the problems that I see every 3 months, or I think every month, is that my patients have the hemoglobin A1C really high, actually more than 8 and 9. And then I just want to solve this problem because I have many patients with type 2 diabetes that have hemoglobin A1C above the 8%. And that means that they have poor glycemic control, and they can increase the risk of complications. The baseline, I just put there like a 50% of patients in the clinic that have elevated hemoglobin A1C. But for me, I say the clinic, but it's for me in my clinic, in the section that I have my patient, that I see my patients, okay? So the intervention that I find is designing diabetes self-management education and program that can involve individualized um, coaching as a dietary counseling and support for medication adherence. The second step is do in the Deming cycle. Is like when you implement the plan change on a small scale um, to test its feasibility and gather data on its impact. The sample about the first step, I just want a continuation of that sample, is to start a diabetes self-management education program with a small group of patients with poor glycemic control. So I can start like in 10 or 15 patients to start this program, okay, small group, to verify if I later on I can meet the goals, okay? And I can provide education during this clinic visit, weekly follow-up, and phone support over 4 weeks or more. The third step is a study or the check. Um, is where I analyze the data collected during the do phase to determine if the change led to improvement. Um, the sample is that after 3 months of evaluation of the changes of the hemoglobin A1C, patients brought the self-monitoring logs and satisfaction surveys. The result, I just want to see more than 70% in reduced hemoglobin A1C or by more than 0.5 percentage. And patient, I just want a patient to report that they feel really confident, okay, managing the diabetes. And the last step of the cycle is the act. If the change that was successful, I can implement it and incorporate it in the standard practice. If not, refine the plan or try another approach. And the sample is expanding the diabetes self-management education program to the entire diabetic population in the practice. That can be starting with my group of patients, and after I see the improvement, I can share with the other providers so they can add it to the other patients. Okay, incorporating ongoing education and follow up into routine care. Continue monitoring outcomes and adjust interventions as needed. If that doesn't work, we can implement other how to say approach to the patient so they can manage better the diabetes. And then in conclusion, the Deming cycle is a fundamental practice for quality improvement. I found that it promotes cautious planning and changes, testing them on a small scale, studying the results, and then acting accordingly, which has made it is a treasure for interactive improvement in healthcare and other systems. It is an organized, evidence-based methodology for the nurse practitioner in the in family practice to initiate and assess improvements in diabetes care. This include the DSME and programs that will ultimately improve patient outcomes and sustain practice changes. And then this is the references that I use for my presentations. Okay, thank you.